we are going to see the examination of fifth cranial nerve. The fifth cranial nerve is called as trigeminal nerve. Okay? And this nerve is a mixed nerve. Mixed nerve means it is having motor function and sensory function. So we will test each function separately. So motor function of fifth cranial nerve is the nerve supplies the muscles of mastication. There are three muscles of mastication. One is temporalis, other one is masseter, other one is pterygoid. In pterygoid you have two pterygoid, medial and lateral pterygoid. So first we will test the muscles of mastication. Okay, you clench the teeth, clench it. No, you clench it. Intermittently you do clenching with closed lip, with lips closed. So you do like this. Okay. So now he is clenching. You can see some movement here. Okay. So these are some movement. Okay. This is the movement of the masseter, and here is the movement of temporalis. Or you can observe in my. So see, I am doing intermittent clenching. Okay. This is masseter, and this one is temporalis. Okay. This is intermittent clenching. This is the muscles of mastication, which is used for chewing. Then you are going to test the pterygoid. Okay, pterygoid, asking to open the mouth. Open the mouth. When you open the mouth, the movement of jaw is going downward. So the downward movement of the jaw is by lateral pterygoid. Then asking to make sideway movement. So you do like this. So this sideway movement is done by medial and lateral pterygoid. So these are the muscles of mastication. So muscles of mastication, if it is normal, then it is the motor function of trigeminal nerve is normal. Then you go for sensory function of trigeminal nerve. The trigeminal nerve supplies the sensation over the face. So here you remember, when you come across face, the motor function of the muscles of the face is supplied by seventh cranial nerve, whereas the sensation over the face is supplied by fifth cranial nerve. So remember, 5 and 7 both are having different function. Now this is the fifth cranial nerve. You have to test the sensation over the face. Like the general sensation where you do in the sensor system examination, here also you do the sensation, what are all the senses, you can do it over the face. Okay. Starting with fine touch. Okay, how to make fine touch? You take a cotton, you make a wisp of cotton. This is getting a wisp of cotton. Okay, you have to make it like this, then you have to do the fine touch. Don't do blindly. Okay, this is wisp of cotton. And ask the subject to close the eyes. For sensory system, we have to close the eyes. Close the eyes. You tell whether you are able to feel it.
Yes, sir.
Yes.
Yes, sir.
I am touching the corresponding areas.
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Okay. This is fine touch sensation. Then crude touch. Crude touch is you just give a pressure with your finger.
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
Okay. Then what other possible? You can go for the vibration sense. Okay. Vibration sense. Stereognosis you cannot do. So fine touch, crude touch, you go for vibration sense. You strike the tuning fork. This tuning fork is 128 Hz, which is used for sensory system examination. Here itself I tell we have another tuning fork. Frequency is 256 Hz. The 256 Hz is used for hearing test, like Rennie's test, Weber's test. The 128 Hz is used for sensory system examination for vibration sense. Okay. You strike the tuning fork, hold the tuning fork like this, in the stem, you strike the tuning fork and place it over the bony prominence. Close your eyes. Able to feel the
Yes,
vibration?
sir. Yes, sir.
Vibration. When it gets over, you tell me.
Over.
Over. Okay, you can confirm with yourself. Okay, now he is telling over. You confirm that. Okay. So this way you have to test the vibration sense over the face. Then as usual you have temperature. So temperature you will be provided with test tubes, with two test tubes, one with warm water, other one is cold water. And you can place it over the face and ask the subject to tell any which is warm or cold. So now it is
Cold.
cold. Okay. Cold. So this we completed the sensory function testing of the fifth cranial nerve. So first we have motor function, second is the sensory function. It's a mixed nerve. And you can go for reflex also for fifth cranial nerve, corneal and congenital reflex, which you have displayed in the previous video. You have to do, because from corneal reflex, the afferent is fifth cranial nerve, the efferent is seventh cranial nerve. Then you can go for a jerk, a deep reflex, that is jaw jerk. So the jaw jerk you have to do with the knee hammer. So you hold it, place your thumb, slightly opened mouth, strike over the chin. Okay. So there will be little closure of the mouth, and this is jaw jerk. So for fifth cranial nerve, muscles of mastication, sensation over the face, corneal congenital reflex, jaw jerk. These things are done for fifth cranial.